Hi, everyone. My name is Dillan Eisenhauer, and I'm the founder of Second Look Cancer. Before I get started, I wanted to say thank you to Cran for having me. I built Second Look Cancer as a completely free tool designed specifically to help colorectal cancer patients discover, understand, and navigate clinical trial options in a way that feels more practical, personalized, and accessible. I'm also a stage 4 colorectal cancer patient myself, so this was also built out of my own personal experience. In this session, I'll give you a quick demo of the platform, show you how it works, and hopefully make the clinical trial search process feel a little less overwhelming and a little easier to navigate. So with that, I'll share my screen and we can get started. So this is your dashboard page. It's relatively straightforward. Once you get here, the first thing you're going to want to do is create your profile or your trial profile or update it. Mine's already complete, but for the sake of demonstration, we'll go through the process really quickly. So when you update your profile, what it's doing is right off the start, you pick your location. So I'm in Toronto, but let's just say I was in British Columbia. So let's say Vancouver. The second I choose Vancouver, it immediately shows me the trials that are applicable to Vancouver. And then also, let's say I wanted national, anywhere in Canada. Well, it immediately shows me the number of trials available within Canada. So I'll just go back to Toronto for the sake of sticking with my normal profile. And also, if you want to add locations, my roots are from Nova Scotia. So if I wanted to mention, I also could take a trial in Halifax, given that my family lives there. It'll also update the trials to be Toronto and Halifax. So we can go to the next, and every single time you click the next button, your trial counter is going to update. So that's really the idea here. So we're trying to filter in trials that are applicable to you and filter out trials that aren't. So a really simple idea is, if I'm stage 4, any trials that are for stage 1 through 3 aren't applicable to me. I don't really need to see those. So I'm stage 4, and we can go down. And again, there's more fields, but just to kind of give a quick overview, you click next, and it went down from 58 or so to 41. And we're going to continue that process. So, you put in your lines of treatment uh, and, your biomarkers. And as you do this, you will get updated trial counters. So we're at 41. And if I click next after filling that in, we're at 22. I do have guides on the website to help you fill in your profile if you need that assistance. Um, and lastly, there's one more page here of again just demographics and such. You click save and continue, and there's the amount of trials that are already applicable to me. So just to kind of recap, we started at about 98 or 80 trials in the space, and we're down to 22 that actually fit my specific circumstances. And there's two ways you can do this from now. There's AI matching, and then there's browse the trials. So AI matching is if you just want a list of top 10, let's say, this is what you click. Browse trials is more of a do-it-yourself. So I'll quickly go through just the browse, which is the explore trial button up here. So once you get to here on the explore trials page, the first thing you're going to want to do is make sure that your filter for my profile is turned on. So really quickly, we can already see that there's 1,000, almost 1,600 trials for colorectal cancer within our database. And just by clicking this button, we've now got it down to 22 that are relevant to my situation, which, is a Canadian in Ontario, stage 4, with, one line of therapy down. So from there, you'll see 3 cards for every single trial. And the first one will have the title and the Canadian locations. Again, this is a global platform, so if you put in your location in the United States or Europe, you will see those locations here instead. How this treatment works, which is kind of a simple version and a little bit more scientific version of what the drugs or treatment is trying to do. And then you'll have your latest readouts, which is just an AI scrape. These are both AI scrapes of this is of the trial, and then this is of the internet going over what data we have on the trial. So every single trial will have this 3 card system. So really quickly, you can automatically see what the trial is, what it's doing. and how what data we have on it so far. So it's a really quick way to gather information and understand trials relatively quickly. Um, that's effectively it. If you don't want to filter for your profile, there's lots of filters on the sides. So for instance, I am a KRAS mutant for my biomarkers. So if I wanted to only look at KRAS trials, I can click KRAS. And if you want to look for your specific variant, you can also go into the variants here. Um, so really the idea of the entire website is to spend 80% of your time on the 20% of trials that are relevant to you rather than 80% of your time trying to find those 20% of trials that are actually relevant. So the next piece of this will be the AI matching tool. This is really where we're sending your 22 trials or my 22 trials that I am that are relevant for me into an AI system to try to pull what likely is the best. And you know, that's kind of a black box of thinking. So I'll try to like simplify it a bit. Is really what I'm doing is giving an AI model directions on how to score each trial for you. So there's four pillars that I've decided on. There's biomarker strategy. So, if it is a treatment specifically for your biomarker, so MSS, MSI high, or, KRAS, BRAF, etc., it's going to score those higher than otherwise. Scientific evidence, think of if we have good data, a phase three trial versus a phase one, phase threes would get marked higher for scientific evidence. Treatment fit is, if you've already tried a drug, it's probably not going to recommend you the same type of drug if you've been on multiple trials. And logistical ease, if you have to go to the hospital every day for 14 days in comparison to once biweekly, the scoring will be different. And if you click this, it gives you kind of the reason why it provided its score. Um, as an aside, biomarker strategy within this, any surgical options are also rated extremely high, only because I think it's really important that patients are aware of potential surgical or curative attempts. So these are all rated high, and if you scroll down, you'll start seeing more drug-related treatments. But these are always the procedural ones are always going to be marked very high. Um, so I won't go through every single piece of this, but essentially it's giving you why the trials match. The same breakdown that we saw on the Explore Trials page of what the therapy does and kind of a more scientific breakdown of the reasoning. And then these are relatively self-descriptive, but if you're interested in any of these, they're all right here and then the reasoning behind the scoring system. So, once this wraps up into a total score, this is why this is number one, because the scoring is higher than what the number two would be. As an aside, the AI never receives any of your personal information. It's completely anonymized. So that's the AI matching. There's other, features. So one that I'll touch on really quick is saving your trials. So, I have the bot battle trial, which is a new phase three trial in Canada. Um, that's an immunotherapy-based trial. I have this saved. So once you click save, you can go into your notification tabs, and anything that changes on the clinicaltrials.gov trial listing will be shown to you daily. So, if a new site pops up, I'll know about it from the website on a daily basis. If uh, if the phase changes or any other contact information, anything about that listing changes, it'll be notified. Um, there's one other feature which I forgot to mention, but it's relatively cool. It's Google Maps for clinical trials. So, these are all the relevant clinical trials for me, and I can go into the map and look at the trials. Um, if I took off the filter, you'll see a whole bunch more trials. But this would obviously be trials that aren't necessarily applicable to me. But again, you can see the whole gamut. Even if I put in, let's say, the United States, you'll be able to see a significant amount of trials. Um, so it's just a good visual way, particularly if you're sensitive to location, to kind of look at your trial listing. Um, so with that, there's more features. I implore everybody to join the website and look around. It's completely free, and I made this just to kind of help people as much as I possibly can with their clinical trial search to make it hopefully just a little bit easier. So that's the website, and thank you for having me, Cran. I really appreciate it, and that's that. Thanks, everybody.